All right. Good morning, Commissioner. Today is Sunday, June 28th, 2020. How are you?
Good morning, Ken. I can't believe it. We're at the end of June. Incredible.
Yeah, we are. Time is absolutely flying, and we know that June has been filled with many, many activities, especially related to Pride Month. And today we're actually celebrating the 51st anniversary of the police raid on the Stonewall Inn, which then led to protests, which have been entitled the Stonewall Uprising, which led to our pride movement across our country and really around the world. So I think we wanted to
hmm
start there today in our message to staff.
Yeah, the last 50 years have given voice to just that notion of I will no longer be silenced. Our brothers and sisters in the LGBTQ struggle, as well as the allies who join them, and, just vocalizing what we will not stand for any longer has been symbolically represented over the last 50 years in marches and rallies and, in forums. And, we found that the louder voices get, the more collective we can support each other. And, I see where we are today in 2020 as we kind of think about the use of our voice and the way that we share information and the way that we support each other. And, it's just an opportunity to pause, to lift up, and to highlight where public policy meets humanity, meets the ability to treat each other with respect and dignity.
Mm-hmm. And I also think it's important to highlight that this past Friday, June 26th, was actually the 5-year anniversary where the Supreme Court guaranteed same-sex couples the right to marry. And a couple weeks prior to that, on June 15th, the Supreme Court ruled that it is illegal to fire somebody based on their sexual orientation and gender identity. So a lot has happened, lot to be celebrated during this month.
Yeah, we have a special edition of the Spotlight coming out that highlights quite a few of the things that you just referenced. And there's a story in there related to a same-sex couple and their journey to adopt through foster and adoption. There's also a tremendously well-written story by one of our staff members who I've become pretty close to over the years. And he talks about becoming his authentic self and what that journey looked like for him as a teenager and, as now an adult professional. And most importantly, how that has shaped, who he is as a dad. And, I can't wait for everyone to see that story and to share in just our better and more global understanding of what a personal journey means to one of our staff members. So hats off, Chris Robles. Thanks so much.
It's really a beautiful piece. So as we said, we hope that edition comes out sometime tomorrow afternoon. And as we are celebrating Pride Month, Commissioner, you are still heavily involved in managing and leading the department through the COVID-19 pandemic, and you're going to be part of a very interesting panel tomorrow uh,
hmm
in regards to an organization out of Waterbury.
Yeah, the Waterbury chapter of Links has asked me to be a part of a panel discussion as we continue to talk about the impact of COVID-19 on communities of color. And, as we continue through just the unprecedented times of understanding this crisis, understanding the healthcare implications of COVID on communities of color and the recovery needed for all of the families that we work with and beyond, it's important that we continue to have our voice out there as part of the Helping Network. And tomorrow it'll be a part of that. We will also participate in the development of a virtual youth forum and really thinking of the impact of how we can help our older youth through not only COVID, but also their transitions into adulthood. So there's a lot of exciting things happening this week. We are participating in a virtual retreat with some of the other regional states around New England. And that brings me to just a reminder that Governor Lamont has issued a travel advisory because Connecticut is uniquely positioned in a tri-state area and we're often a pass-through. We have to pay attention to the fact that our state has done a significantly great job at tamping down our transmission footprint, but we know that other states have not. And so there's other states have been designated as hotspots. And what he has decided to do, along with some of our neighboring governors, is to really put some restrictions on people who are coming and going from those hotspots into Connecticut. And so we have to still, of course, within the department and within our own planning, to whether we're transporting kids between states or making visits outside of our borders, recognize that this is still a significant public health threat, and that we will not be contributing to the deeper penetration of the transmission by traveling in and out of the state. So any permissions, particularly to places like Florida right now, there's parts of Texas, there's parts of Arizona and others. Those are things that are changing every day. We have to make sure that we have a special permission and the explanation as to why that would be necessary during this time. It's still pretty intense. We have to make sure that we're adhering to all the public health guidelines as well.
Absolutely. And Commissioner, you mentioned resuming full operations. This past Friday, we sent our initial plan to the Office of Policy and Management, which has been requested of all state agencies, which was really a tremendous effort to pull and synthesize all of our efforts from really pre-March 15th up into the present, to demonstrate to OPM what we've done, what our plan is moving forward, and some additional ideas.
Yeah, we were positioned really well. All state agencies have been working on their reopening plan. We've kind of called ours resuming full functioning because we know that we never closed. And because we had taken the steps to set up the COVID mailbox, get feedback from our staff, set up four distinct internal work groups. We set up work groups and subcommittees to get feedback externally from our state advisory council, our regional advisory councils, legislators. We meet with the labor unions regularly to hear some concerns from their memberships. We meet with our provider groups, whether they're contracted or our credentialed providers. And all of those groups have collectively offered information and insights as to how DCF should be considering the next phases of our resuming full functioning. We got some feedback from foster parents and from some folks with lived experience through Favor and AFCAMP. And so Elizabeth Duryea and the group of systems PDs has been charged with kind of pulling all of that information together. And we submitted our first iteration of what resuming full functioning looks like at DCF, asking some questions, but also leaving some things still to the development as we understand where the science is taking us, but also what the needs of our workforce and the needs of the kids and families that we serve, as well as our stakeholders like our providers, will need as we move through. So baby steps, really taking our time to make sure that the plan is solid and it takes into consideration all of that feedback. But we've submitted our first pass and we'll wait to get some feedback on that.
Yep, and when I guess when it's appropriate, after OPM has taken a look at it, we will get that out to all staff. And our community partners. And I think we would certainly encourage staff to take a look at it because it really speaks to all of what we have done. And I think that's really came through when I read through it, is all the extensive efforts that you have led, that multiple people within the department have then taken on to position ourselves to be right where we are. And I think at this point in our video, you typically give staff the opportunity to shut off the video because you're going to talk about statistics, which we know we have, but there's actually some positive news, I think, related to some of the statistics you're going to mention.
Yeah, one of the things that is important to also know is that there has been a decision with 5 state agencies that the direct care staff will have mandatory testing to give a better sense of where the transmission is in relation to those vulnerable hotspots, like congregate settings, like our prisons, like the nursing homes, like the congregate care settings that we have in our SOLNET. So you'll get some information this week too about the testing related to the direct care staff at both of the SOLNETs. And then, of course, we're going to share what some of that data has looked like for us in just a minute. So as like we just said, that the Connecticut footprint has significantly decreased in terms of our transmission. Within DCF, we added one more staff member to that staff positive. So we're up to 35 staff members, with 33 of those having returned to work. We were up to 66 caregivers, and that 66 is broken down by 25 TFC providers and 41 kin or core foster parents who have tested positive. And the interesting and unique statistic that I think you were referencing a minute ago is that we've still maintained and held steady with only 15 youth who have tested positive. So kids that are committed to us that we follow pretty closely, we're only at 15, and we're all of which who have recovered according to our medical division. They continue to follow them pretty closely. But I think that we've done a really great job of, really narrowing our transmission rate and really trying to be controlled and being cautious. So we can't let off the gas now.
Nope.
We have to make sure that we continue to wear masks. We continue to socially distance. We continue to do as much of our work virtually as possible. And we continue to want to make sure that as we participate in things on our own time, that we continue to be vigilant in that mask wearing and the social distancing and hand washing, and continue to make sure that we clean and sanitize, all surfaces. So those are the things I feel like have committed to memory over the last 4 months, and for our foreseeable future. This is the world we live in right now.
Absolutely. Absolutely. So we wish you a great week, and hopefully you can continue to get some rest on this beautiful Sunday. I think it's going to pour over here, so I'm counting down the minutes till that happens.
Rain is good too, Ken.
Rain is good. Yes.
All right. Take
Take
care.
care.